So you're now live.
Okay, welcome everybody. So today's session, A3, is on trusts and perceived economic consequences of COVID-19, a cross-country comparison of newcomers and racialized groups in North America. So today we're gonna discuss the financial constraints that have been faced by newcomers and racialized groups in Canada, the US, and Mexico. Specifically, we're gonna look at issues of job loss, wage loss among these groups during the pandemic, as well as their capacity to meet financial obligations and assist their family members. Panelists will also explore the relationship between perceived economic impacts of COVID-19 and trust amongst newcomers and racialized groups. So we have some very distinguished panelists today. Starting off, we have Catherine Donato, along with Lauren Henasey. And Catherine is a professor of international migration, a director at the Institute for the Study of International Migration at Georgetown University in Washington, DC. Lauren is a research assistant also at the Institute for the Study of International Migration. And just to give you a little bit of background, Catherine's research interests are very much related to global migration. Amongst her most recent work is a new edited volume on the landscape of the US legal migration and refugee integration in Canada, Europe, and the United States. She is the PI on a new project about assimilation and mobility experiences of US immigrant adults who entered as unaccompanied children. And she's also co-principal investigator on a project that examines the environmental conditions, how environmental conditions affect outmigration from communities in southwestern Bangladesh. Now, Lauren is, as I mentioned, she's a research assistant working with Professor Donato and at the Canadian Institutes of Health Research on the socioeconomic impacts of COVID-19 on Indigenous, migrant, and racialized groups throughout Canada, the US, and Mexico, which is very much tied to this project, what we're working on today. She has previously worked for Soul Sisters Leadership Collective, conducting research on restorative justice practices, and the Women's Foreign Policy Group, promoting women's voices in international affairs. So her interests include women and gender in international affairs, conflict and peace negotiations, and migration. Without further ado, I'll pass it off to Catherine and Lauren.
Okay, great. Thank you so much, Paul. I'm going to share my screen and we will begin. Hold on a moment. Let me get it to presentation mode. Okay, there we are. Everyone can see, right? Okay, great. Thank you, Paul, for that generous introduction. And thanks, of course, to my co-author, Lauren, who is also in the Zoom room, and she will correct me if I've gotten anything incorrect, and also if my cold gets the best of me. So we are using data from a larger project. So our analysis is really one little piece of a larger project funded by the Canadian Institutes of Health. It's a 3-country comparison of COVID impacts, emphasizing newcomer and Indigenous differences. There's a lot of data being collected by this project. There are detailed interviews, there are representative samples that are cross sections over a period of time. Our analysis is using the first 2 cross sections collected in October 2020 and March 2021. We've combined those samples and we're going to present some very preliminary, initial results that we will now build on as we move through the summer. So we're really quite interested, before we get to the details, in COVID impacts on a variety of things. But for this survey, we began really focusing on self-reports of financial impacts, economic impacts of COVID. So there are a series of indicators that help us really understand those impacts. And again, these are all self-reports. And so we're going to be using 7 survey items. Broadly speaking, when we get to the regression results, you'll see 3 dependent variables from those 7 items. But these are items that ask people, again, in each country and in both of those cross sections, whether or not they've experienced impacts from COVID on their job earnings or their retirement incomes, impacts on, whether they experienced job loss related to COVID, and job gains, but at lower wages than their first job. And as well, impacts on their ability to meet financial obligations, whether it's paying utilities, capacity to assist their families to do so, and meeting basic food requirements. So for the first job earnings and retirement income, we look at that separately, but then we constructed a simple summary index, pulling together the two survey items on job loss or getting a job, but at a lower wage. And then we pulled together these four, what we're calling people's capacities to meet their financial obligations. And again, a summary index there too. You'll see the items both presented individually and separately, individually and then in the survey, in the summary index form. So, I mean, what are our hypotheses? Really, we start very simply by saying there was no playbook for countries managing COVID-19 pandemic, or in fact, no playbook, global playbook for managing a pandemic that really reached around the world in the early 20th century. So we certainly expected, with no playbook, we expected significant country level differences. We also expected differences in these self-reports of financial COVID impact. We expected differences given what we know about, social science prior studies, based on two status indicators, gender and nativity, after controlling for other factors that could affect these self-reports. And then finally, because countries have complex systems of stratification, we expected that the effects for gender would vary by nativity. So we expected interactions here of these effects. And so that's kind of where we started. So this is our very first figure that we'll present. It's based on descriptive results. And really, we're just looking at differences by, nativity and by gender. And what stands out here is that foreign-born men, now this is across all countries, but foreign-born men are more likely to report impacts on job and job earnings or retirement incomes than the other three groups. If we look at job loss, reports of job loss and job gains at lower wages, we see that foreign-born men as well, they're comparable to native-born men in terms of the reports of job loss. And we don't really see many differences, although we do see here when there's a star, I should have pointed that out before, that means there's a significant gender difference within country and then and within immigrant group. So we see some signs of gender differences, but we don't see signs of nativity differences here. And then finally, again, based on simple descriptive results of self-reported impacts regarding financial obligations, and you can see the legend to the side what those four types are. We can see some differences, a few gender differences, but here we see substantial differences between foreign-born women and native-born women, with native-born women reporting more of those differences, or more of those obligations. And then we see some differences here between foreign-born men and native-born men. So we then move to kind of beginning to think about this in using multivariate methods. And our goal here again is to assess, to what extent do nativity and gender operate? And how does country, what extent do we see country differences? So the very first model here that we're showing is for the first self-reported impact on job earnings and retirement income. And with only these variables in the model, and you can see greater self-reporting among Mexicans than than people in the US. You see no difference between Canadians and US residents here, but you do see an effect for nativity, meaning foreign-born. You see greater impact there for foreign-born, or more more self-reporting of those impacts for immigrants, and you see no gender differences. In Model 2, we are now including controls for, Model 2, we're including controls now for age, education, income, number of children, and years. And we see a few things that occur. First, we see the Mexico coefficient shift in size and remain, in direction, and remain significant. So now Mexicans are less likely to report COVID impacts on job earnings and retirement. And we see the nativity effect remaining. Now, keep in mind that we are also controlling here for, as you can see at the very bottom of the slide, year, which is what we call the sort of the year or the time of the cross section. From these models, we then derived, we added to Model 2 that you just saw, and we entered nativity gender interactions to that model. These are predicted probabilities that show, again, of the self-reports of impacts on job and retirement income. And we can see from the predicted probabilities that foreign-born men have higher chances of reporting COVID impacts on retirement and job income compared to the other three groups. So we do something similar now for looking at the self-reports of COVID on job loss and job gains at lower wages. And now the dependent variable is this summary index, which just ranges from 0 to 2. And here we see that Canadians were much less likely to report COVID impacts along these lines than US residents, and Mexicans were more likely. We see no effect for being foreign-born, and we see an effect for gender, which suggests women are less likely to report these job loss or getting jobs at lower incomes than men. This is a smaller sample size because this includes, for these two outcomes, we include only those people in the labor market. So it includes unemployed as well as persons in the labor market. In Model 2, the Canadian coefficient remains significant and negative, meaning that Canadians are less likely to report these impacts than US residents, but the Mexico coefficient becomes not significant, partly because we're controlling for other factors, age, education, income, which helps to explain away the Mexican effect, at least in this model. What we do see, however, is that we see nativity matters. Foreign-born are more likely to report these impacts, and that the gender coefficient remains, suggesting that or showing that women are less likely to report these impacts than men. So if we then, from this OLS regression model, we then take that model, we add gender nativity interaction into that model, and here is predicted values from that interaction model. And we can see that foreign-born men are more likely than any of the other three groups to report these job-specific COVID impacts. So in the last round here, again, we're using now the summary index that helps us combine the 4 measures of financial obligations. And the first model includes only these variables that you can see. And again, Canadians are less likely to report COVID impacts related to their ability to meet their utility bills, pay their utility bills, have adequate food, and help their relatives compared to US residents. In the Mexico case, however, we see that Mexicans were much more likely than US residents to report those COVID impacts. And here, for this initial model without any controls, we see no effects for nativity and no effects for gender. Once we control for age, income, number of children, and year, we see that the Canadian effect certainly gets smaller, but remains significant. And the Mexican, it's the same story on the Mexican side too, that the Mexican coefficient gets smaller, but remains significant. And we see an effect for foreign-born that we didn't see before. And then here is from building on a model 2, adding an interaction between nativity and gender into the final model. We can see that these are predicted values from that final interaction model, and we can see that foreign-born men compared to the other groups have report more COVID-related impacts on, or self-report more problems meeting financial obligations, including assisting their family. So what does it all mean? Well, we're still working on that, so we appreciate any comments that anyone has. We can certainly see that self-reports of economic impacts of COVID vary by, across a systems of stratification that are based on nativity and gender. And so we see that intersection, I think, clearly in these models. We also see a fair amount of variability at the country level, and such that Canadians reported less job loss and less or job gain for fewer or lower wages, as well as fewer COVID-related financial obligations to other people. And Mexicans were less likely to than US residents to report wage or retirement income effects, but like Canadians, they also reported fewer financial obligations. So where are we now? We will, for the rest of the summer, think about what how the impact of nativity shifts and gender shifts when incorporating race. So we'll begin by doing some straightforward three-way interaction variables with these, with these three variables. We'll see how that works. We are also interested in really digging in now into work status. So currently these two cross sections of data have information on whether someone's employed in the private sector or in the public sector. But occupation, I believe, is in the next cross section of data, which the data have been collected. I believe, Paul, you'll shake your head yes to that. But we don't yet have those data in our hands. So we will look at, we'll analyze that next cross section's worth of data as well to dig into whether or not, for example, the differences we see between foreign-born men and the other groups perhaps disappear or differentiate themselves further if we're talking about high-skilled versus low-skilled immigrants. So that's one kind of key avenue for the summer's analysis. In addition, we're interested in children and households, and we didn't show you this, but the number of children correlate positively and significantly with all of these self-reports that we're looking at. So we will, I would say these three tasks that you see here, actually all four are really important, but certainly we're going to dig into how children matter to help us understand nativity effects and gender effects. And then finally, what explains the country variation in these self-reports? And this is also going to require a fair amount of effort, because I don't really understand. I understand some of the effects, especially for Mexico compared to the US, but not the first one, for example, that we saw in the first model. So country level indicators perhaps could offer additional insights. So removing the dummy variables and including indicators about, at the level of the country, although, that's a pretty high aggregate, but still that's something that we will look into. So with that, I will say thank you, and open it now up back to Paul.
Sure. It's great that you mentioned children and number of dependents, because as you were speaking, there was somebody who had a question about that. And I don't know if you were looking at the chat, or it was just perfect timing. So the question was from Chris, a very interesting study. Did you control for number of children or number of dependents? And you started to mention that. And they were asking us, they did a very similar study in Canada where many participants had their parents as dependents that we needed to consider. But there's a follow-up question in terms of how are these numbers when you compare them with impact of COVID on job in each of the gender groups? Are men in general more impacted than women?
Okay, well, let me just say it first on the children. So, I don't know, and Paul, maybe you could tell me if the data do offer us the ability to capture dependents that are not minor children in households. I live with one, so I'm keen to do that if we can do that. Just to let you know, the number of children in our house, in our analysis, or the number of minors living in the household at 17 and under. So it's a straightforward way to do it. It's not necessarily going to capture everything that we need to do. So one of the things we want to do is look at minor children, minor children, right? Less than school age children, to see if we can get a bit more leverage on what's happening here. But Paul, do you know if we can include dependents who are not minor children?
Unfortunately, I'm looking at the data right now as we speak, and the variables we have in here in the current surveys are how many people currently live in your home, including yourself. And then we ask how many children that are between the ages of 0 and 11 and 12 to 17. So we don't specifically ask, as far as I can recall, if there's any adult dependence, but it is definitely something that we could consider in the near future. But the size of the household would somewhat get to that. We might be able to do a household analysis where we pull out various people and then it would help to answer the question. Wouldn't answer it fully, but so we can take a couple questions in between here, but I do want to get on to the next presentation as well. We will have time at the end where we can answer more in-depth questions. But Lauren, I'll pass it over to you.
No, my presentation was with Catherine.
Okay, that's all of it. Okay, great, excellent. So Monica, this is it'll be on Monica now. Monica Boyd. Let me just give you a little bit of background about Monica. She is a Canadian Research Chair in Immigration, Inequality, and Public Policy, and Professor of Sociology at the University of Toronto, Canada, Georgetown University, in Washington, D.C. Oh, that's not right. University of Toronto.
Oh, that's Catherine. That's Catherine.
There's a spell typo there. So either you're a professor at both universities or just the one. Probably just the one.
I didn't make up this. Okay.
She's trained Monica's trained as a demographer and a sociologist. She's an expert on international migration and ethnic racial stratification. Her present research investigates refugee labor market integration, migrant women in Canada's care economy, trends in occupational segregation, and children living in linguistically isolated households. So in addition to her numerous contributions in an advisory and consulting capacity to Canadian government departments, the UN, OECD, Dr. Boyd has served as president of the Canadian Sociological Association and the Canadian Population Society, and as vice presidents representing the Academy of Social Sciences and the Royal Society of Canada, and as chair of the International Migration section of the American Sociological Association. So I will pass it over to Monica, and I'm looking forward to your presentation.
All right, so I have a bit of a problem. I don't know whether Chris is there still.
Hi, Monica.
Um,
So if you,
Every time I click on something, I seem to lose. I've lost now the screen, and I don't see where
if you press stop screen share,
I don't have anything up. Current site. Oh, wait a minute. I do have. Let me try this.
You just pull it up.
yeah, just pull it up. It's at the bottom of your screen there.
There we
can
go.
see it. Yeah, and then if you just press from beginning,
From beginning.
there you go.
Okay, and then I'm going to get rid of this. All right. I should also mention that Catherine is a past president of the International Migration section of the ASA. We haven't directly overlapped, but we certainly share some common histories. It's always fun to see her. So the title of my talk is COVID-19, Low Institutional Trust and Economic Hardship. And it is like Catherine's and like actually other papers that I've been privileged to see the slides of early on. We are all in a beginning mode, and often with multiple agendas that will get winnowed down as we go along to something a little bit more coherent. I'll explain in a minute what exactly I'm going to be doing. I do want to thank I do want to acknowledge the lands on which the University of Toronto operates. It's been the traditional land thousands of years of the Huron-Wendat, the Senecas, and the Mississauga Credits, and it is still actively used today by the Indigenous people across Turtle Island, and I'm grateful to have the opportunity to share their space when I was working on the project. I also want to remind people that, and thank also the people involved for allowing me access to this data. I'm part of what is a social impacts, COVID-19 social impacts network that is listed at the bottom of this slide, where it says website with reports. The real hewers of the wood and drawers of the water are Jack Jabbob, Pura Ladner, and Laurie Wilkinson, who were the PIs for the Canadian Institutes for Health Research grants that helped fund this. But there are many, many partners involved, much of the research also being collected through Leger. It's just been really nice to get an opportunity to work with this data. I think what we'll end up concluding, the collective wisdom of Catherine, Lauren, and I will probably be that there's much more to do, and the difficulty with getting social scientists on something like this is that we always want more questions, but we can discuss what that will be later. So the focus of my presentation is this general link between trust and economic hardship as a result of COVID-19. It's very much structured by what's available through the two surveys that were collected, as you've heard, in October 2020 and in May 2021. And my talk has really three components to it. I want to begin with a little bit of an introduction as to why trust is of interest in a time of COVID, why it's important to look at levels of trust, and particularly one version that I'm going to be using, which is called institutional trust. I want to then ask about differences between countries. Like Catherine, she said there was no playbook, that was her terminology. We would expect Canada and the United States to be somewhat similar by virtues of their histories that really go back a long, long way. The Mexican history, of course, goes back a longer way. But as we're reminded of, and as Catherine has also done research on, the developmental histories, the economic development histories of Mexico have been somewhat more different from her two cousins to the north. So the only real hunch we have is that maybe things would be a little bit different from Mexico. And then I want to, having developed the notion of the definition of trust and why it's important, I want to conclude by looking at what the economic hardship indicators might imply about trust. Trust can be interpreted, trust is generally in the literature studied as two different kinds of interrelated concepts. There's interpersonal trust, which is an individual's expectation of other members of the society. It generally means that the person expects that people will act in a certain way that will cause them at a bare minimum no harm. And there is then also what is called so interpersonal trust is usually measured by I trust people around me. I trust my friends. I trust my relatives. There is sometimes questions asked which ask about trust of strangers, but that is also seen as interpersonal. These have to do with the dynamics between individuals and the way that people expect people to behave with each other. The institutional trust is really of keen interest, particularly to people in political science or political sociology. And it's the confidence of citizens in institutions. And it's interactive, that generally speaking, if you've got high trust of individuals for the important institutions in a society, it means that they expect them to work well, to work efficiently, to protect them from harm. The rule of law is effectively a mechanism used by many institutions to protect citizens from risk. And that is actually what I'm going to be looking at today in my talk. There's another aspect to trust that I'm just going to touch on. It certainly cannot be studied in this study, but is studied in more elaborate studies of trust, and that is that trust is reciprocal. Trust can be used to support institutions, but when institutions prove themselves worthy of trust, it also enhances trust. Similarly, studies have shown, and some European studies for COVID have shown this, that if the populace does not deem governments or other institutional players as having acted responsibly, particularly in the area of public health, that the trust in government goes down, and that it makes it very, very difficult for governments to enact the functions that they're supposed to be doing. That's an aside, but it's one of the reasons why, again, political scientists in particular are interested in trust. There are some good reasons for why one wants to look at trust, however, just talking about COVID-19, because pandemics introduce risk, they change institutional responses and trust levels. There actually are a couple of really good studies out right now that show how that is done, far more complex than what we're capable of presenting with our surveys here. The findings that are interesting, which is that who knew that the Spanish flu of 1918 had long-lasting effects on levels of social trust, particularly interpersonal trust. And that's been very well documented. Getting COVID depresses interpersonal and institutional trust. In a way, that's not a particularly profound insight. If you get COVID and you think you're going to die and you wonder what's happening to the public health system and you think the government isn't doing enough, that's your linkages right there. But these are well-documented trends. And there are also trends that look at the way in which COVID, through impacting on economic well-being, affects trust. There have been studies done of the impact of the 2008 Great Recession, as it's called in the United States, and also recessions between about 2007 and about 2010 in the EU, the European Union. that show that the worsening economic conditions depress institutional trust and trust that individuals have on institutions. So what are the measures of trust that we have in this study that we can look to, that we can ask? Are there country differences? Are there differences in terms of internal country stratification, particularly with respect to racialized groups? And what is the role of economic difficulty in all of this? In very similar to the data that Catherine and Lauren were talking about with respect to economic difficulties, there are 7 questions that are asked in the surveys, the 2 surveys that were asked. And it is essentially with regard to the COVID-19 coronavirus. To what extent do you trust? And then it's read out. City or municipal authorities, state or provincial authorities, central government, public health. Then we move into, after we did the 3 on the government levels with ascending governments, we move into 2 that capture attitudes toward what might be called leadership based on expertise, which would be public health officials and the World Health Organization, and then media or journalists and religious leaders. I chose to interpret all of these as a form of as representing different institutions or leadership roles of trust. There are other questions on trust that are asked in the survey. A couple of them, one on the role, one, do you trust scientists? Another, do you trust pharmacists? Is only asked in one survey. I pulled the surveys in my analysis. So I wanted something that was asked in both surveys. And I did not, as I said, look at interpersonal trust for reasons that we can get into. The responses are coded in 4 main categories, with the 5th category being I prefer not to answer, which is really equivalent to the no answer that's asked in a lot of no answer response that's given in a lot of surveys. So the main levels of trust are a lot, somewhat, not at all, not a lot, not at all. And I worked with the concept of low trust. Why low trust? The thinking again is that if COVID is going to have an impact, it's going to diminish high trust. We're going to see more low trust. And so low trust is really what you want to look at. And also, if you're concerned about the relationship between trust and institutions, you could look at high trust, but you probably, in the time of COVID, also want to look at low trust. Excuse me, I'm going to have to clear my throat. So I'm very much shaped by the research grant. And what I want to do today are 3 things. I want to answer 3 questions. I want to do 3 country comparison. And then I want to look at vulnerable populations. I do have data on the US, but for reasons of time, I'm going to talk only about Canada when we get to the vulnerable populations. So the questions really are, they're very much derived from the survey, but they do have a bearing with respect to the larger trust literature. Are there country-specific differences in the levels of trust in institutions and leaders? What variations in low trust exist among a racially stratified population? And another way of saying this is, do the groups that are known to be disadvantaged also have lower levels of trust? We would expect that partly if the source of the disadvantage comes about through past histories and discrimination. It can also come about because there are different levels of education that may mean that they have a very different view of the world than other groups that might have higher levels of education. So there are many reasons why we would expect some variation in trust levels among groups that are distinguished by their visible minority status or color. And then I want to conclude with a very brief look as COVID-derived economic hardship derived economic hardship, reduce institutional trust. And in particular, what does that do to vulnerable populations? I do want to talk briefly before getting into this, and I'll speed up as we go along. How do you handle 7 dimensions of a 4-scale item, right? With great difficulty. You could probably do a factor analysis where you bunch them all together and say, well, we've got 3 main sort of axes. And that, in a sense, is, I think, what Catherine was really doing intuitively. And you could do it with this, but I also feel you lose some of it. So I did one of two things, and you'll see me flipping back and forth. I worked with all 7 categories, but only with what was called low trust, which was, I don't trust this institution, federal government, a lot. My trust in the federal government is not a lot, or my trust in the federal government is not at all. Okay, so that's what's defined by low trust. So that was just a very quick, this is indicating that there's a proportion of the population that doesn't have much faith in this particular institutional or leadership form of trust. And then I had a derived count variable, which I calculated in 2 ways. And this is where I probably will lose you. But I simply bundled everything up into, first of all, the very easy one, what proportion of the population is what we call high trust and what proportion is low trust. So no low trust issues versus no low trust in at least one area. I also then counted up in how many areas did those people who said I have low trust in at least one area, and how many areas altogether, how many out of 7 possible topics or areas of trust did they choose? And as you might expect, people run out of steam after giving you 2 to 3 levels or areas where they don't trust. But there is a core that's kind of interesting, and you can see it in the data, who either had respondent fatigue or were just really quite annoyed. And they just ticked off no trust, no trust, no trust for 7 questions all the way through. And it's sort of like the same group just marches through. And so there is a proportion that is fairly high at the end that say, well, we have 7 areas where we have very low trust. This is when I said, you know, you could look, if you start with category 1, just reduce it to low trust versus everything else. This is the percentage low trust by the locus of trust, meaning the type of trust, and the country. And you'll see that Canada, this is the proportion that say, I don't trust them a lot or not at all. And you'll see the green bar being Canada. It moves left to right with the trust in city or municipal authorities, trust in state or provincial government, trust in the central government, which is a federal government usually, public health officials, who, media, journals, and religious leaders. And it's pretty consistent through the public health, in the sense Canada's the lowest, the United States is slightly higher, and Mexico is the highest of all. Relative to Canada, these differences are significant. Okay. In the case of the World Health Organization, the Mexicans actually have lower levels of low trust. That's a double negative that will send you screaming home for your, or streaming to the refrigerator for a beer. But what it just simply says is that the flip side is the Mexicans have high trust in WHO compared to the levels for the other 2 countries. And so it tends to proceed until you hit religious leaders. And I find this interesting. First of all, I find interesting that among Canadians, the United States, and Mexicans, with the exception of their distrust of the central government, the media doesn't garner a lot of trust. The proportions who say low trust are fairly high. They're higher than certainly the public health officials and the World Health, and higher in the case of Canada for the government authorities. But it's religion that goes off the chart. Something on the order of close to 70% of the Canadians say that they don't trust religious leaders, drops down to about 47% for the United States and goes back up again for Mexico. This is precisely when one really wants, as a social scientist, to have more data. You know, you want more questions like, is the United States lower than Canada because the Republican Party is extremely attached to the religious leaders that exist within that party? What is going on to make the distrust of religious leaders in Canada? From what I've seen in the data, I would just offer two conclusions that I haven't been able to substantiate as of yet. Well, one comes out. Part of it is due to the Aboriginal population. Those of you who've been following the news know that about 10 days ago, there was a discovery of 215 bodies in Kamloops in a residential school, with another 751, I believe, out in Saskatchewan, which certainly could be underlying that peak. Although the Aboriginal population was one of many populations, other visible minority populations in Canada. The dip in the United States could be due to this political religious affiliations and combinations that exist there, but we don't really have the questions to decipher that. But I find it fascinating that the mistrust is lowest for the public health officials and WHO, so that's a good sign in the time of COVID. It's the highest for the religious leaders, and there is a fairly clear country gradient that goes Canada, the United States, goes up from Canada to the United States, and Mexico. So again, I went back to my indicators as well. Remember, one of them is just saying, did you say low trust for any of these 7 indicators? It turns out 82% of the Canadians do, 78% of the United States, people in the United States do, so it's pretty close. Mexico, 84. The numbers in parentheses are what happens if you take out the religious responses, the responses to the religious leaders, and it goes down. Canada reverts again back to that. Canada's the lowest, the United States is in the middle, and Mexico is the highest. And then of those who said they had low trust in at least one of the 7 areas, what was the average number of responses? And so in Canada, again, it's lower than it is for the United States and Mexico, although it's fairly similar for those. So that's sort of the descriptive element of trust. There are some real country differences going on, and there are also differences by type of institution or leadership. Because the grant was given in order to shed light on what were called vulnerable populations, which is taken to mean racialized populations, and then also newly arrived minority groups, particularly immigrants. I wanted also to show you just how it varies among some of these racial groups. For those of you who are coming in from the United States, visible minority status was a term coined in the mid-1980s to try to capture the essence of race. And it is designed to, in addition to identifying the indigenous population, it's designed also to demarcate people of color. There's some differences between the scales used in the United States and in Canada, which Catherine and I can tell you about. The main one, 2 main ones being, we don't really identify Hispanics, which are actually seen as a separate kind of ethnic group in the United States. We lump them in as Latin American. And then the Iranian population is considered white in the United States, whereas it's considered part of the Iran group and a group of color in Canada. So what you see in this particular chart is, again, the gradient is kind of still there. The proportions saying they have low trust in public health and in the WHO institutions is generally lower than it is for either forms of government or for the media or for the religious leaders. But you'll see marked differentials. Coincidentally, the computer gave me orange to represent the indigenous peoples. This is a color that is now being used to indicate solidarity and grieving over the death of all these children in the residential schools. The blue is Canada, the orange is the indigenous population, the gray is Black, yellow is Chinese, not Chinese, sorry, yellow is Asian. And what is off the screen here? I can't see the bar for the other ones. The very last one is Middle Eastern, Arab, Iran, and Iraq. So what you see throughout is that the indigenous population in each one of these areas is except for religious leaders, is the highest in terms of the proportion saying they have low trust in that particular institution. The Black population is lower than the white population, and that's a significant difference. And the South Asian is lower still. When you get to the Middle Eastern and you get to the Iranian and Iraq populations, it goes back up again. That's the green bar. And again, more questions. It would be interesting to have a religion question. Is the lack of trust due to what is in fact increasingly discussed in the Canadian context, which is an anti-Muslim fervor that these groups feel very definitely attacked by? And when we go to religious leaders, what's also driving this very high proportion in Canada is it's the white population that also says slightly over 70% say they have no trust in the religious leaders. Again, the difference between the white population and the Aboriginal population is not significant. So those two groups are having very high levels of low trust for religious leaders, probably for very, very different reasons. I will speed up a little bit. This is just giving you an example, again, working with my more aggregated measure, what proportion have at least one or more areas of low trust. Interestingly enough, there's not all that much difference between Canada and the United States when you go into some of the more specific groups. 84% white in Canada compared to 80 white in the United States, and so forth. The Black population is not as high as the indigenous population or as the white population in terms of the proportion having low trust. And then on the right, we just see the number of areas of low trust. And again, we see what was shown earlier on, which is in Canada, if people have low trust in one of these 7 areas, they don't seem to have as many areas of low trust on average as they do in the United States. So that kind of concludes my look at differences in countries. As I said, it's really motivated by the fact that this is a 3-part country. The Mexican data set for the first 2 surveys does not have a high population that fits these categories. Most identify as Hispanic. And so we really didn't have very much to work with on this. So that's why the presentation's Canada and the United States. Just running quickly through, this is Catherine's and Lauren's 7 categories. And I'll just quickly work her through because she's done this before. These are the 7 individually. Catherine's done an admirable job describing how she collapsed them. But again, we see what you would see in her slides, but also when we look at the individual things, which is that Canada, for the most part, Canada has lower proportions experiencing financial difficulties along any one of these indicators than does the United States. Canada's in green, the United States is in yellow, and then Mexico is in orange. Mexico consistently says that it has much higher percentages saying that they are facing some kind of economic difficulty due to COVID. And again, you can sum it up. Do people have at least one or more financial difficulties? 54% of people in Canada said that they had at least one difficulty. 53 in the United States, very similar, higher still for Mexico. And then again, we see Canada, however, has a lower number of people doing that. So I introduced this other area that Catherine and Lauren have talked about, which is financial difficulties. And I asked, does it make a difference for trust? Because you actually would expect, if you have financial difficulties, you might start to question the institutions and the leadership that you think are responsible for public health policy, that you think are responsible for economic policy, for the loss of your job, etc. And indeed, we find in Canada, so here I'm focusing just on Canada, we find that that's indeed the case. The pale blue bar is the group that says, I've experienced at least one kind of difficulty. And this is the proportion who say they have low trust, okay, by the kind of difficulty that they had. So we're not here looking at the type of trust that they had. We're looking more at the influence of these different metrics of financial difficulty. And in all of them, the population that says that they've had at least one area of financial difficulty is in fact saying that they have higher levels of low trust. And again, we see this through these indicators that I've been doing. Like Catherine, I did a regression. And I'm not going to go into this because this is precisely what I tell my graduate students: never, ever, ever present at a meeting. We've all been to meetings where somebody will have a PowerPoint display at the far end of the room, and somebody puts up their table and forces you then usually goes through row by row by row, column by column by column. But I will tell you what it adds up to, because I've got several of these. And so what it adds up to is that the number, when you just try to look at the overall number of economic, this may be wrong actually, the number of times that. Right, okay. So if you take a basic question and say, did you respond to the trust questions by having one or more areas of low trust? Does the number of type of economic hardships matter? And the answer there is no. It doesn't seem to matter at all. So the conclusion that I reach, and I've done a multivariate analysis where I've controlled for other factors, is that actually the racial stratification profile is pretty intractable. Having economic hardship matters, but not whether you've had 1 or 2 or 3 or 4, just in terms of whether you have low trust or not. There is a typo here. This doesn't make any sense to me. What does happen is that if you, okay, I know what's happening. If you take the actual number of areas of trust, so this is where it does get complicated. So one is just saying, did you have low trust in any of these areas? The other is saying, in how many areas did you have low trust? So did you have 0, 1, 2, 3, or 4, or 5, or 6, or 7? The number of economic hardship areas does influence the percentage. And the groups do start to converge. And in fact, I said already that the Aboriginal population was not all that different well, it is different, but what happens is it becomes insignificant. And the groups start to converge, and you actually, by the time you do a full-blown model where you're controlling for many of the things that Catherine and Lauren talk about, which is you're talking about the type of hardship, the number of hardships, you're talking about immigrant status or not, you're talking about being male or female, and you're talking about education. The racial differences between groups in trust go down, and in most cases, they're insignificant. So the economic hardship is important, but it seems to be, in terms of the number of areas of trust, it seems to be that you have to have a full count of how many areas of economic hardship did you have. An educational difference really makes a difference as well. And that's not surprising. Usually, when you start looking at differences between groups, that's what you see. So to conclude, I ask a couple of questions. What are the country-specific differences? We saw that Canada has the lowest percent of low trust. It does vary by type of trust. What variations in low trust exist for the racialized populations? For Canada only, I have done the comparison with the United States, but I haven't presented it. Aboriginals have, this is again sounding a contradiction in term, the proportion saying low trust among Aboriginals is high and is among the highest of all groups. Latin Americans also are high, but not as high as Aboriginals. And those from Asia, which is a very aggregated group, needs to be unpacked, has much lower proportions saying they have low trust. So does COVID-derived economic hardship reduce institutional trust? What about the vulnerable populations? The answer is at the bivariate level, there is definitely a relationship. Economic hardship is associated with a greater propensity to say that you are experiencing, that you have low institutional trusts. And that is true particularly among some of the vulnerable populations defined by visible minority status. When you take into account how many areas of economic hardship groups have experienced, that goes a long way in explaining the variation in trust between visible minority groups. And then when you take into account educational differences, that removes most of the significant differences that exist. The only significant difference that remains is the Iranians, Arabs, and Middle Eastern population. So there's much to do. I'd like to go back and redo everything now that I've gone through the first round. Unlike Catherine, I'm not sure I have a whole summer to devote to this, but I'd like to see greater, I collapsed the distinctions thinking I was going to compare Canada and the United States, which I didn't do in this presentation, but I really think it's time to go back and pull them out. I'm also really intrigued by the relationship of attitudes to vaccines and trust, and I'm intrigued by the relationship to the questions that we have on discrimination and trust. I think all of these are going to prove very important when we start to discuss country differences in institutional trust and when we discuss within country differences in institutional trust. So thank you for your attention, and I'll be glad to address any questions you might have.
Thanks, Monica. We're going to shift over. We have time for just one question. We're running a little bit short on time, but there was a question in the Q&A about in the Canadian context, and I'm going to load up my presentation as you answer this. What would be the reason for low trust among Asians within the Canadian context?
Okay, so actually, I'm just going to. So the Asian group has the lowest proportion saying they have low trust. A different way of saying it would be the Asian proportion has the highest, the Asian group has the highest proportion saying they have high trust. You know, there is a theory saying that with the anti-Asian sort of expressions that have been going on in Canada as well as in the United States, that should have an impact on the trust. On it very well may have, but we don't have the kind of before-after data to show that. I think what is going on is that the Asian group, if I had to go back and redo this again, I would really, within the limits of a very small sample, you know, 5,000, 6,000 in each wave, I would want to, and that includes all countries, I would want to go and break up the groups a bit more. The Black population in Canada and in the United States is extremely heterogeneous. Minimally, you want to break it up by foreign born or not. The Asian population consists of people from the Indian continent. It consists of people from Southeast Asia, from East Asia. It includes people from the Philippines who are part of East Asia. It includes a large group of Chinese, but the Chinese also are representative of the diaspora. So in many ways, I object to this artificial lumping of Chinese because I think it also homogenizes a varied background that people have. So, you know, what you're picking up is probably the Chinese are the largest groups among the Asian, followed by the South Asians. The South Asians include Bangladesh, you know, Pakistan, India. I think you've really got to look at different groups because they have had different histories of migration. They've had different histories of settlement in Canada, different coming over at different times. I don't have a very good explanation as to why the proportion is so low, having low trust. I think if you can break it up into larger groups, you'll see more variance.
Okay, well, thank you. Thank you, Monica. So with the remaining minutes that we have here, I'm just going to quickly share an index that I've been building on these same 7 financial questions that have been alluded to throughout these previous 2 presentations. And so I started to just play around with adding these questions all together, just in a simple index to see variations across the 3 countries and variations between racialized communities and immigrant groups across the 3 countries. So let's start off here. So we're calling this the Financial Vulnerability Index. And as you've seen these questions before, it's basically the index is those who respond yes to has the coronavirus or crisis financially affected you when it comes to the following: your income or retirement income, losing the job you had before the pandemic, settling for a new job with lesser pay, your capacity, excuse me, to meet your financial obligations, your capacity to assist immediate and extended family members, and meeting basic food requirements. So these are the percentages who respond yes across the 3 countries and then combined for North America. You can see in general where a lot of the red is where the most vulnerability is. So in Mexico, and this was very much represented in Monica's slides in the bar charts, you can see, especially with regards to capacity to meet financial obligations and helping the immediate and extended family and basic food requirements, those are all really high. So it's affected the majority of the Mexican population in regards to those financial vulnerability items. And for the most part, Canada and the US doesn't show large differences, although Canada does seem to be faring better in terms of having lower vulnerability overall. Especially like if you look at basic food requirements, only about 20% of Canadians indicate yes versus 28% of Americans, and again, 52% of Mexicans. So basically what I did is I just combined all these 7 measures into one composite measure. And they showed a high reliability together as expected. The Cronbach's alpha was 0.862, which is a really good score. And we normalized the data so that the index would have a minimum value of 0, a maximum value of 100. So for each individual in the sample, if they said yes on all 7 items, their score would be 100. And of course, if they said no on all 7 items, their score would be 0 with increments between about 17% or so. So just to look, we're going to look geographically. If you look at Canada, and this is just a reminder here, these are the items that are in this index. So how does vulnerability, economic vulnerability, financial vulnerability look in Canada? Well, overall, it's again, Canada actually fares the best out of the 3 countries. Their overall score was 24.8. So you see this financial vulnerability index. If you had a score of 28 and above, that was considered quite high within the Canadian context. And you can see that BC at 29, Alberta just at over 30, and Manitoba at 31 on this index score, all had the most financial vulnerability amongst the provinces in Canada. Saskatchewan, a little bit less so than Manitoba. We had large enough samples because this was a combined sample across the 2 surveys that was mentioned before. I think there's about 15,800 respondents in total in North America, with about 6,000, roughly 6,000, 6,400 in the US, around a little bit over 5,000 in Canada, and a little over 3,000 in Mexico. If you look on the East Coast, you can see they're doing much better in terms of the financial impacts. It's not having as much of a financial impact on residents of Canada in the East Coast. So Quebec, the score was only 19, Newfoundland, Labrador 17, New Brunswick 17, and Nova Scotia a little bit higher, but still lower than Western Canada at 22. So you can pretty much see that it's in Western Canada, they're feeling the financial effects of the crisis more so than in Eastern Canada. Now let's look at the United States. So remember, in overall in the United States is 28.4. In Canada, overall was 24.8. And just keep in mind that the higher the score, the more financial vulnerability according to those 7 items. And you can see in Canada, in the United States, the hardest hit region, and this is just done regionally, not by states because of sample size and some issues. And also I didn't want to show 50 different numbers on here. It would be a little bit too much information. But if you look at West, South, Central, so you're looking at like say Texas, Louisiana, that area, you have a high score of 35.2, which is the highest among all regions of the United States. The South Atlantic and Pacific regions also seem to be quite vulnerable in terms of the financial vulnerability index. So the South Atlantic states, which includes Florida and Georgia, you have 29.9, about 30 on this index score. And the Pacific region, so Oregon, Washington, California, Hawaii, you have about a 29 rating on this index. And you have much better outcomes in terms of the Northeast and the Mid-Atlantic region in particular, where you have New York and Jersey and so on, about 25. And in West, North, Central, so you have the Dakotas, Minnesota, it's about 26. So it's lower than the rest of these areas. The mountain, East, North, Central, East, South, Central areas all had in that middle range of 27 approximately on this scale score. Okay, so looking now at Mexico. Mexico is divided based on 5 different areas. So you have the north, which actually fares the best out of all the regions in Mexico. That being said, you can see overall, Mexico has a scale score of 48, which is twice as high and twice as much vulnerability in terms of the Canadian population, which was at 24. And we've seen pretty much the further south you go, the more economic vulnerability you have within North America, which is very much represented in the previous two presentations. So in the south of Mexico, the scale score actually goes all the way up to 54.5, which is just astronomically high if you consider the other regions in Canada and the US. Whereas the north was only 44.7, which is lower for Mexico, but again, it's still higher than in Canada and the US in any region. And in the central area where you have the Federal District of Mexico City, it's a little bit lower at around 50. And in the west and east regions of Mexico, that's a little bit better at 46. Okay. So we wanted to look at specific groups, again, racialized communities within the three countries. Of course, they're not always grouped or classified in the same manner. It depends on the census used and so on. But so what you'll see is there's some blanks across these groups of the three countries because the question just doesn't apply, or the sample sizes was just too small. I needed to have like a minimum threshold. I think I wanted about at least 70 or 80 respondents for each country before I mentioned their numbers. So that's why some groups are crudely grouped together, which is notwithstanding that there's a lot of variability, a lot of diversity within these groups, and this is based on the data, the decisions made. But you can see for the white, those who self-identify as white, in Canada, about 22% on this scale. Again, 100 would be the max, 0 would be the minimum. You have in the USA a little bit higher at 26, and in Mexico, the white population in Mexico is the most vulnerable at 48%. If you look at Indigenous, Aboriginal, or First Nations, or in the USA, it's American Indian or Alaska Native, higher than average. Well, actually, Canada's right about, it's right about the average for Canada, 30.8, but higher in the US, 38%. If you look at the Latin American population, you have 36% in Canada, 47% in Mexico. And if you look at the Hispanic or Latinos, the way they ask it in the United States, it's 37.7. So Canada and US is similar in terms of Latin background, but higher in Mexico again. We only had a sufficient sample in Canada for the Arabic population, which is quite high at 40%. You see it's getting into the red shade. The Black population in the USA was more vulnerable than the Black population in Canada, so it's 40% versus 34%. Asian or Asian American was the category used in the United States only, that's 27%, so they're actually pretty low vulnerability relative to other groups. If you look in Canada, for instance, you have South Asian and Southeast Asian populations, which are quite high at around 40%, 39 and 42% respectively, whereas East Asian, which includes Chinese, Japanese, Korean in Canada, was quite low, similar to Asian or Asian American in the USA, 25%. And the other category was actually the highest in Mexico. So if you identify as other group in Mexico, you have 59% vulnerability versus about 28 to 31% in Canada and the United States. So you can see that generally the Mexican population has high vulnerability across the board, as we've seen in the previous data, but there are some variations amongst groups, other groups within Canada and the US. So looking again at the same financial vulnerability index for immigrant status, we can see there's some interesting flip-flop here because immigrants in Canada seem to have more financial vulnerability than non-immigrants. However, the inverse is true in the United States, where immigrants actually have lower economic vulnerability than Canadians. It's almost like just a flip in terms of the numbers even. Across the board in Mexico, immigrants and non-immigrants have much higher vulnerability, but immigrants are slightly higher in terms of vulnerability in Mexico. And lastly, if you look at mother tongue, we can see that the English population in Canada and the US, relatively low vulnerability, about 26, 28%. In Mexico, it's double that, it's 53%. If you're an English speaker in Mexico, you're really facing this financial vulnerability as a result of COVID. The French-speaking population in Canada seems to be quite resilient in terms of their economic vulnerability, at only 17% on this index versus 32% in the USA. In Mexico, there wasn't a sufficient sample size of French. And the Spanish population, which we were able to look at across the countries, we can see that it's the most vulnerable in Mexico again, followed by Canada and the United States. The Spanish population in the United States is actually the least vulnerable. And according to Indigenous language, for mother tongue, we couldn't break down the numbers by country because the numbers were too small. But overall, across the 3 countries, you do see very high vulnerability if your mother tongue is an Indigenous language at 42%. And other was quite low in terms of other language groups across the 3 countries. And so that's all I have for the presentation today. I will go back to the floor and see if we have any other questions for any of the panelists. It looks like we do. We have a few chats. So we are running out of time as well. I think we had one other question. No, I think that was it. Unless there's any other questions, we can conclude. No, okay. Well, I'd like to thank all the panelists for being here today. It's been a pleasure. And one of the questions I will just close on is these presentations will be made available via YouTube, from what I understand. So we'll send out a link to the YouTube channel through your emails and you can access the presentations. So other than that, I wish you a great rest of the conference and hope to speak to you all soon.